want to welcome our fellowship applicant who's joining us today. I really love this time of year because we get to meet all of the soon-to-be geriatricians, and it brings me great joy and hope for the future. So it's a nice kickoff to that season as well. So please give a warm welcome. So for Geriatric Medicine Grand Rounds, we have two really fantastic speakers who might be familiar to many of you since our paths cross a lot. We have Dr. Chris Rhoads, who is a clinical neuropsychologist who has been with the Memory Brain Wellness Clinic for many years now, provides really fantastic clinical care. But a big part of his role, has been to lead a lot of very important initiatives across Washington state and locally to improve the care of people living with dementia and their care partners. He's been a leader with the Dementia Action Collaborative for quite some time, and there are education initiatives and clinical improvements that are happening across Washington state because of his work and the work of his team. He's also the founding leader, co-leader of Project Echo Dementia, which is educating primary care providers and others throughout the state to improve the care of older adults. And they have a whole wonderful curriculum that you should check out. He's done many things, and the work with the Memory Hub as well is just fantastic. And Katie Zeitler, who I haven't had a chance to meet and work with as much, is the program director for Dementia Friends, which they're going to spend the hour telling you about, so I won't tell you about. But she's done a lot of wonderful work in trying to get this program rolled out across Washington state to, again, improve the lives of people living with dementia and their care partners. She works with the Memory Brain Wellness Clinic, and her main role is to lead Dementia Friends, and she's doing her work over at the Memory Hub, which I'm sure they'll tell you all about. It is just great to have both of you here and to get to know your work a little bit better. And I'm excited for everyone to hear more. So thank you for taking the time out of your busy schedules to talk to us today.
All right, I will go ahead and share my screen. So good morning, everyone. It's a privilege to be here this morning. Thank you so much for this opportunity to share a little bit more about Dementia Friends Washington. During this presentation, I will be sharing about the background of the Dementia Friends program and the program structure. I'll also share a little bit about our information sessions. I'll talk about, what we go over with our attendees, and then I'll talk a little bit about where we're headed next. As we move through this presentation, you'll notice that there are images on some of the slides of Dementia Friends at various sessions throughout the state. And these are just a few of the almost 5,000 Dementia Friends that we have in Washington. A little bit of background. So Dementia Friends is a global movement changing the way people think, act, and talk about dementia. Dementia Friends is based off of a concept that began in Japan, where the original program, known as the Dementia Supporter Caravan, was launched in 2004 by the Japanese government. The goal was to respond to Japan's rapidly aging population by raising public awareness about dementia and equipping everyday citizens with basic knowledge and supportive attitudes. Participants attended short, accessible sessions to learn about what dementia is, how it affects people, ways to help. And then those who completed the training were given an orange wristband to signify their role as supporters. And this program spread widely, with many people across Japan becoming these supporters. The concept was then adapted by the Alzheimer's Society in the UK in 2013 and has since spread across the world. So the image to the right on the slide shows a map of the world, and highlighted in blue are countries that have a Dementia Friends program. So there are now more than 20 million dementia friends globally.
Katie, we're seeing your view of the slides. I don't know if it's able to be changed, but they might be a little bit bigger if you're able to switch to slide view.
Thank you. Sorry, I didn't realize I have two screens, so I apologize for that.
It's
Just
okay.
yeah, thank you for letting me know. Is that better now?
It looks great.
Okay, great. Thank you. All right, so in the United States, US Aging holds the license to run the program. And housed within this agency is the Dementia Friendly America initiative, which began in 2015. This is a national effort to foster communities that are inclusive, supportive, and accessible for people who are living with dementia and their care partners. So all sectors of the community, such as businesses, healthcare, transportation, faith communities, and local government, are encouraged to work together to create these environments where people with dementia can continue to engage and thrive. The Dementia Friends program for the United States launched in 2017 under the Dementia Friendly America initiative. And any state that is interested in offering the program designates a state lead, pays a one-time fee, and then becomes a sub-licensee of the program to then run the program in the state. Okay, so before launching statewide in Washington, a pilot project was run to see if Dementia Friends was a good fit for Washington. So this project was led by a UW MSW MPH student, Alyssa Tarafo Rafferty, and it had two main goals. So one was to evaluate how the program impacts people's attitudes, comfort, and knowledge about dementia, and then to see, testing the feasibility of offering it here in the state. So we held sessions in 3 counties, in Yakima, King, and Jefferson counties, and trained 15 Dementia Friends champions or volunteers to lead these sessions. We had 214 individuals participate, with half of them being from rural areas. The age range of the participants was 19 to 23 years old, and attendees completed pre and post-test surveys and then a 1-month follow-up. So the results showed that Dementia Friends positively affects attitudes toward people living with dementia. These information sessions can help reduce stigma and build awareness, which can help to foster dementia-friendly communities. So since then, the program has grown. As mentioned, we now have almost 5,000 Dementia Friends across the state, and we have close to 90 volunteers. Since January 2024, we've seen an increase in almost 3,000 Dementia Friends, which is pretty amazing. So community members are very interested in this information. I feel like they have a lot of questions. There's kind of this thirst for knowledge, and they always leave kind of with a more hopeful attitude and wanting to know more. So the UW Memory and Brain Wellness Center serves as the state lead for the program and is supported through the work of the Dementia Action Collaborative. The Dementia Friends program is also written into the Washington State Plan for addressing Alzheimer's disease and other dementias, and we are a state-funded program. So this growth is possible because of a strong network of regional partner organizations, including area agencies on aging, senior service organizations, and community centers. So on the screen is a list of our regional partner organizations, and I'll quickly read through it. So Northwest Regional Council, the Olympic Area Agency on Aging, the Camino Center, Homage Senior Services, the Area Agency on Aging and Disabilities of Southwest Washington, Southeast Washington Aging and Long-Term Care, Aging and Long-Term Care of Eastern Washington, and then the Lewis Mason Thurston Area Agency on Aging. And this is a map of our states. The counties that are in dark green are counties where we have these regional partner organizations helping us to implement the program. And the light green areas are areas that we're still working on expanding into and seeking a partner organization to work with. And I'll also add that in 2024, we onboarded 8 new counties, and this year we have onboarded 1 new county, and we have another one in progress. So hopefully we'll be able to continue to add a couple more counties before the end of this year. So Dementia Friends uses a train the trainer model. As program manager, I train all of our regional partners who then train volunteers, whom we call champions, because they champion the cause, to lead these information sessions. I also train volunteers and lead sessions, and our regional partners lead sessions as well. It's very much a team effort. So we chose as a state to add in kind of a middle person, our regional partners, because they know their regions the best and have the knowledge of how to best expand this program into their areas. They also can meet in person with their volunteers and provide additional support to them. Not every state follows this exact format. Many states have, their designated lead for the state who just works with volunteers across the state. So we kind of added in a middle step. And you'll see there's an image on the right that kind of shows the hierarchy in Washington State, or of the program, and then in Washington State. So just quick review, I've mentioned some of these things already, but we have Dementia Friends USA, part of Dementia Friendly America, US Aging, that's kind of our parent organization. And then the state lead for the program in Washington is the UW Memory and Brain Wellness Center. We have our regional partner organizations across the state who then work with the champions or volunteers to offer these information sessions out in the community. And then some regions have a lead champion who helps the regional organization train and kind of oversee volunteers. And then anybody who comes to one of our sessions is known as a dementia friend. They have the awareness about dementia and have committed to taking an action item to foster dementia-friendly communities. All right, and a little bit about our champions or volunteers. So these are community members from all walks of life. They don't need prior dementia experience. We provide the training and a script for them to use. Just a side note, we use a script to keep everything consistent so that anyone who attends a session anywhere in the state is receiving the same information and a similar experience. Our volunteers need to have an interest in public speaking. That's pretty much the whole volunteer role, doing outreach and raising awareness about dementia. They plan and they lead the information sessions and act as ambassadors for the program. So to become a champion, there are 2 required steps. The first is to attend a Dementia Friends information session and become a dementia friend, and then to attend a champion training. This is about a 1.5-hour training. We also have volunteer overview modules available on our website now. These are for interested volunteers to get a little more information about the program. So we talk about, what is the Dementia Friends program? Why do we need dementia awareness? And what is a dementia-friendly community? And then we talk about the roles and responsibilities of our champions. After doing some additional surveying this past year, I worked with 2 UW Doctor of Nursing Practice students. We have created on-demand modules to further support our volunteers with information on how to do outreach, public speaking tips, using relevant tech, and providing additional information around the resources that we share at the end of the workbooks that we pass out to all of our attendees. This was something that a lot of volunteers felt like they needed more support around. So I wanted to be able to put together kind of a tools for success training for them. And then once a month, I host a champion huddle for all of our volunteers across the state. This is an opportunity for everyone to kind of connect with each other, receive program updates, talk about what they're doing in their own communities, inspire each other, and then learn about new resources. All right, so what does a Dementia Friends information session look like? So our sessions last an hour. They're free to attend, they're free to host. They're led by our trained champions who use a script. They can be held in person, virtually, in a hybrid format, or we now have a new on-demand option that was created by Dementia Friends USA. Sessions are designed to be interactive and informal. Anyone is welcome to attend our sessions. I do get questions frequently, is it appropriate if this person comes to the session or someone living with dementia coming to the session? And it's open to anyone who wants to become a dementia friend. Each participant will receive a workbook. So on this slide on the left, that's the front cover of the workbook. It just has a few quotes on it and then a question that we do with the group. What is one word that comes to mind when you think of the word dementia? The workbook is about 10 pages long. There's a lot of great information in it. It has spaces to do some of the interactive exercises with other people in the group. And then page 9 of the workbook is a list of resources. So our attendees also, after they complete the session, they get a recognition item. So it might be a button that says Dementia Friend that they can wear, or a certificate of completion, or maybe both. And then during the session, we talk about what dementia is. We offer kind of just a broad definition of it. We do not go into too much detail. And then we talk about the most common type of dementia, some less common types of dementia. There's a couple of sentences about how it's diagnosed and genetic considerations. We added those two in because there were so many questions about them that I just wanted to have, a little something about each one to support our volunteers because they were getting asked those questions as well. We do talk about typical aging. So what are some things that typically happen as we age? And then what are some early signs and symptoms to kind of be aware of regarding Alzheimer's? We share 5 key messages to know about dementia, such as dementia is not a normal part of aging. And then we talk about some communication tips. So how can you communicate with someone living with dementia? And then towards the end, we have a very short section about brain health, which right now, what we're using for this is the Alzheimer's Society Canada landmark study. It's 12 actions for a healthier brain at any age. I anticipate that we'll probably be updating this once we get a version we're working on through the DAC for brain health. So it's nice to have the brain health section in there right now, just because it was something that also was coming up a lot at the sessions. People had questions. What can I do to reduce my risk of getting dementia? How can I keep my brain healthy? So I'm happy that we have a little bit of information in the session now to kind of accommodate that interest in those questions. At the very end, we encourage everybody to take an action item. So now that they have become dementia friends and they have this awareness about dementia, what are some actions they can take to help support people living in the community who have dementia? So a few examples of this would be maybe being more patient when out in public, starting or supporting a dementia-friendly effort in the community, maybe a memory cafe, maybe getting involved with advocacy work or research, and more. So there's a whole list. They also can choose their own action item, but those are to help kind of give them some ideas. And then at the very, very end, we kind of go over some resources and support that are available. So because we are state funded and per our license agreement, we're not able to advertise for businesses, products, or services. So these are examples of some of the resources that we share at our sessions. I'm not going to go through all of them, but I just want to kind of highlight a few of them. So we share about the Dementia Friendly America website, which is a wonderful resource for various sectors out in the community to get more information about how to make their space dementia friendly. So there are different sector guides on the website. So if you're at a faith-based organization and you want more information about how to make that space dementia friendly, there's a wonderful guide on this website that can give you some ideas and some tips. Another thing that I like to point out is the dementia roadmap. So if I do an in-person session, I always try to make sure that I bring these booklets with me. This is the one that is developed by the state. This is a really wonderful tool for people who want to have more information. So, it goes through everything from if someone's wondering and worried, talks about mild cognitive impairments, and then looks at early, mid, and late stage dementia. I really like that there are action item lists within each section. So I point that out to our attendees, just so they have that awareness that it's in there. And if I do a virtual session, I do try to send a PDF of this booklet and let them know that if they want to have a tangible copy of it, there is a place where they can order that on the DSHS website. I think you can get 5 copies for free or something like that. So, and then we have I wanted to point out the International Association for Indigenous Aging's website. They have this really amazing tool called Dementia Rooms. If you haven't checked this out before, I highly recommend checking it out. It's an interactive part of their website, and you can go into different spaces or rooms on the website and kind of click around and see how to make that space dementia friendly. So it's a really great tool. All right, and then one of the most powerful parts of the program is when participants choose an action they will take after the session. So in 2024, the top 3 action items that were chosen by 135 dementia friends in Washington who completed these optional evaluations that we have were to, 1, carry out a more personal action, such as being more patient when out in the community, 2, adopting 1 or more dementia-friendly practices in their personal or professional life, and 3, getting in touch and staying in touch with someone they know who is living with dementia. These may sound simple, but multiplied across thousands of people, they can create real change in how communities support those living with dementia, and no action is too small. And then here is an image showing dementia friends taking action out in their community. I'm just going to highlight a couple of these. So a restaurant owner, for example, is taking action by creating a condensed menu with pictures. I like to use the example of the Cheesecake Factory menu. If any of you have ever been to this wonderful restaurant, they have about 300 options on the menu, which is great because there's always something for everyone, but it can be overwhelming to read. So maybe one way to make the restaurant dementia friendly is to have, a shorter menu with pictures of the food that is not as overwhelming. Another example from a nurse, I give the patient time to respond and I don't interrupt. So one of the things that we talk about in the communication section of the Dementia Friends session is the 20-second idea. So when you're communicating with someone living with dementia, giving them about 20 seconds to get a response back out to you. So we highlight that because sometimes people get impatient when they're waiting for a response. And we like to kind of talk about why that's happening. Their brain is just working differently than yours. It may take a little bit longer for them to process what you've said and get a response back out. So that's another great action item. All righty. And then Washington State has a designation to be both an age-friendly state and a dementia-friendly state. So a dementia-friendly community is a neighborhood, city, region that is aware, accessible, and inclusive. That means that people with dementia and their families can participate fully and contribute, whether it's shopping at a store, riding public transit, or joining a neighborhood event. When we bring dementia friends to these different sectors out in the community, like businesses and libraries, faith-based organizations, etc., we're bringing awareness and action to help build these dementia-friendly communities. And dementia friends can really help to foster these spaces. We can offer information sessions to different sectors in the community. So for example, we had a champion in Spokane offer a session to a financial group last year. And then in Clark County, we have a trained champion who works at C-Tran, which is the transportation system down in that county. And they offer sessions to all of their new hires. So these are 2 really great examples of kind of reaching out into the community with those different sectors and providing this additional awareness. And then here are a few quotes from Dementia Friends after attending a session. One person shared, I drive for a community taxi service and appreciate ideas for how to help potential rides with dementia. Another person shared, I feel that my new awareness will help me to have a forward thinking attitude and how I can be supportive to those around me with dementia. I also just kind of wanted to share some of the translations and adaptations that we have available in our state. We have the International Association for Indigenous Aging has a cultural adaptation of the Dementia Friends materials for the American Indian and Alaska Native. Their sessions are 90 minutes long instead of the 60 minutes that the kind of general sessions are. They add in much more information about brain health. And so we're able to use this adaptation in our states. They just require that we go through their training or any of our volunteers go through their specific training for it. There's an adaptation of the materials for the IDD community. We have translations available right now in Spanish, Mandarin, Russian, and Vietnamese. And then we've just finished our youth curriculum and are going to start kind of evaluating it and piloting it for K through second grade and third through fifth grade. And I will be working with another DMP student from UW this fall and winter on evaluating that third to fifth grade curriculum and trying it out. So looking forward to that. All right, and then looking ahead, so we plan to continue to expand throughout Washington. We want to continue reaching underserved and rural communities and high impact communities. And then we do have a goal of reaching 7,000 dementia friends by the end of June of 2026. And these are just a few photos from events on the right. The top one is from Pride in the Park back in June in Seattle. I put this photo in here because it was such a wonderful event. We had about 300 people stop by our table that day and, really just ask great questions and were very vulnerable with their stories and wanted to get involved. So it was just a wonderful community event, and there was a lot of interest. I wasn't necessarily expecting that much interest in dementia at Pride in the Park, but there was. And then we had our Brain Health Block Party in First Hill back in June also, and the image on the bottom is just one of the little tents that was put up on a table with our partner organization, Murano, with one of our key messages. Murano offered an outdoor cafe for the event, and the servers were people who are living with dementia. So that key message states it's possible to have a good quality of life with dementia. And here's a collage of more dementia friends across our state. And then in closing, I just want to thank you so much for your time and attention today. If you're interested in learning more or receiving information such as a flyer to share out with patients and families, please reach out. Our website is on here, or if you want to scan the QR code with your smartphone to be taken to the website, that's up there. And then my contact information is on here as well. So thank you again for the opportunity to share about this program, and I will now turn the time over to Dr. Rhoads to share about Project Echo Dementia.
Well, thank you very much. Katie, that was totally awesome. And, you are doing such good work on decreasing stigma and, just such important kind of grassroots and kind of ground up work and top down. So I really thank you for also sharing the stage this morning. This really was your presentation and offered to let me come in and talk about a few other things that dovetail with this effort. I also want to thank Dr. Bennett for the introduction and have a tremendous debt of gratitude in that we would not be where we are with Echo Dementia right now if it were not for programs like Echo Geriatrics. And I see multiple faculty members, so I'm a little sheepish talking about this, knowing that many of you know more about Echo than I do. But it's a lovely opportunity to tell you a little bit about what we've been doing as one of the other funded initiatives that have legislative funding here in the state of Washington. The other thing I will add, Katie, that maybe you're too humble to mention is that not only was Dementia Friends sustained in terms of funding during a very difficult budget cycle, but also it was an increase in funding the last cycle that has been sustained. And I think that is a testament to the work that you're doing and all of your colleagues. It's resonated with our state and our legislature in a big way. So it's my pleasure to talk to you a little bit about our ECHO project and the Dementia Friendly Washington Learning Collaborative, which is kind of the sister program. And I'm hoping to move through this pretty quickly and then have time for conversation. And I know, again, I'm telling you a lot of things you already know, but hopefully I'll give you some new info as well. Here are all of my disclosures. One of the lovely things about being a psychologist. So I'm not going to take you through all of the details of the history of how we kind of got to where we are. It's early, you're good people, and you deserve better than that. But I do want to say that this stretches back, over 10 years, really. And I see, some folks who were involved in the initial Alzheimer's disease working group that kicked off in July of 2014. I have had the privilege of being the chair of the Health and Medical Subcommittee since the inception of the working group. And then once the plan that we came up with, which was a really fantastic public-private partnership covering everything from, dementia prevention to public health to end-of-life care, dementia kind of education and readiness, building a workforce. When that was accepted by the legislature in February of 2016, many of us stayed on to form the implementation group. So the hope with our state plan, and this is a picture of the original one, you saw the updated one in Katie's presentation. The hope was to create something that wasn't just something that sat on a shelf, but was implementable. And what we were told by the legislature after they said, this is fantastic, we were told, so what can you do with high visibility and impact, but no funding? And so that was our charge as of April of 2016. And instantly, we kind of replicated the same process of capitalizing on existing relationships. And one of those partnerships and relationships was the BRE Collaborative here in Washington State. And huge thanks to Dr. Rick Goss for helping with that. But they selected Alzheimer's disease as one of the 3 areas they wanted to work on for 2017. I got to chair that working group as well. So we came up with best practices that were accepted by the Healthcare Authority for kind of setting the standards for dementia care in Washington. At that point, after we had done all that work, we needed a vehicle to disseminate all of that. And ECHO seemed like a logical place to do that. So I had the really weird but awesome experience of testifying in front of the Joint Legislative Executive Committee. And I think that's where the geriatrics ECHO and all the other fantastic ECHO work done at the University of Washington paved the way, because they got it right away and we obtained funding. We were one of multiple projects funded in July of 2019, and we have been rolling since. For those of you who aren't super familiar with the ECHO model, this is something that comes out of the University of New Mexico with the goal of demonopolizing expertise and building that expertise out in rural and underserved communities for primary and other allied healthcare providers who know their patients the best. I frequently marvel at the distance people travel to come see us here at Memory and Brain Wellness. Not just from remote parts of our state, but the region, Alaska. And that's true for, the Falls Clinic and senior care as well here. So the idea of being able to empower primary care providers in those communities to detect, diagnose, and manage dementia the way we would here, and then sending the ones who really need a tertiary specialty evaluation. So the idea of, instilling knowledge and moving that knowledge, it is a hub and spoke model. The other thing that has been such a fantastic piece of this is it truly is an all teach, all learn. We have learned so much from our communities in Washington who are doing fantastic work around advanced care planning, or maybe how they've implemented the Medicare annual wellness visit and then linked that with a more detailed cognitive evaluation. So I think we've benefited from that just as much as our community has. It is very kind of clinically focused didactics, and then best case scenario, you have a case or two. It is like pulling teeth, getting cases sometimes, as I'm sure Dr. Bennett can attest. But what we spun with this when we talked with the legislature was that not only could we use this platform for medical best practices, but also things like dementia friends and other dementia-friendly activities. And that really got their attention in terms of, oh, wow, so you can use the same kind of approach to not only build the dementia workforce, but also program support services that we have a richness of here in the Seattle area and Western Washington to a degree. And that has been equally as fantastic. So we obtained funding in July of 2019. We took our time to make sure we were building this correctly and had all the right players. And we launched in 2020. The model is that of, your expert hub. And I put expert in air quotes because I think everybody that is participating is an expert. For us, we decided we wanted an interdisciplinary, not a multidisciplinary hub. And our goal is about 20 to 25 spoke sites out in rural communities or underserved communities or under-resourced settings, places that don't have behavioral neurology or neuropsychology. So we have some folks that are single providers, solo practitioners, in Yakima or out in Ellensburg. We've got some group practices, and then we've got good involvement from places like Virginia Mason Franciscan, Multicare, so multiple providers that attend from there. We meet for 75 minutes twice a month. We offer free CME, CNE, which turns out not to be really the value proposition here, but it's really more the community. Here is our hub team. And I am super proud that this is truly not just an interdisciplinary, but an interorganizational effort. So even though I'm the PI and it's administrated through the Department of Neurology here, my co-lead and good friend and colleague, Nancy Eisenberg, a behavioral neurologist at Swedish. Our palliative care person is at Virginia Mason Franciscan. Our pharmacist is from Overlake. So, we really, it's kind of a rare, all too rare, I think, example of organizations collaborating for the greater good. And I think that is possible because it truly is a dementia action collaborative effort. So that's been super meaningful. We wrestled with kind of how we were going to get this up and running and whether we wanted a cohort model, kind of like the 10 basics that you need to know, and then you graduate out and, do you try to do that or do you try to really build expertise with the community? We decided to go with a community model. We also struggled a little bit in that people were otherwise occupied in June of 2020, especially primary care providers during the time of the pandemic. We have thought carefully about how we bring new folks on and have decided to build kind of a core basic 10 sessions that people can, watch on their own. We've thought about, do we kind of do the traditional echo model of all the quote unquote experts are in the room? We've decided not to. So we've decided to all stay on our individual screens, which feels a little bit more democratic. So all those kinds of things. We are still working on ways to create something like a dementia care champion and maybe unlock a new CPT code that you could only access. There's been some work in California around that. And we frequently wrestle with how to bring people in from outside of Washington. One of the limits that we have being state funded is that we really can't use Washington dollars to train providers from outside of Washington unless they serve large proportions of people from Washington. So we have worked hard on our website and usually direct people there for didactics and resources, and they're always welcome to contact us. I'm always amazed too, meet people at conferences or somebody just reached out from Nebraska and said, oh, I saw this echo session and, our top 10 sessions, most viewed, we've got about almost 5,000 views for those. So I kind of forget about that reach sometime too. So since we've launched, we've provided about 2,300 instructional hours. That number is a little bit old. And it's been super cool to hear back from people that, oh yeah, not only am I changing my practice based on what I've learned in Echo, but my colleagues are also starting to do some things differently. So about 2/3 have noticed changes in their organization. We're up to about almost 100 sites at this point and close to 280 providers. You can see where they come from around the region. We are still actively recruiting folks. We would love to have more folks participate. And we are also, I'll talk about that in a second, but we're trying to do a better job of, demonstrating our impact by keeping some stats and some outcomes. But my approach is that I kind of just trust that this is doing what it's doing. But you can see, some of the data that, people are both, satisfied with the quality. They rate their knowledge before the session versus after, has increased. Same thing with confidence. So there's got some data. But what we have done recently that I think is novel and super interesting is to partner with the Washington State Department of Health, who received a BOLD grant, the Building Our Largest Dementia Infrastructure grant. They asked, how could Echo help with some of the education and workforce development, with that. So we have historically struggled to bring people from FQHCs and rural clinics in. The providers are interested. They don't usually have the bandwidth due to the demands on their schedules. They have been a high focus for us in that they typically serve populations disproportionately affected by dementia. So our thought was, could the BOLD grant provide small but meaningful amounts of funding for a couple of FQHCs to compensate them for their time, maybe a data pull or two. So we took a while to work out the MOU between the University of Washington and the Department of Health. But I am pleased to announce we had opened up a RFA and we had some applicants, and we now have two sites, so North Olympic Healthcare Network and HealthPoint, who will be participating both in ECHO and a related project by Dr. Gaster and Dr. Rhoads, which is the cognition in primary care. If you don't know about that one, that would be a great didactic also at some point. That's really more aimed at transforming clinic level dementia capability, where as we're kind of training up the Echo champion or the dementia champion, so they go hand in hand. What we ask of these organizations is that they watch those 10 foundational didactics, they take a post-test, they have to attend at least half the sessions, they have to do 2 case presentations each that pads our cases, which is great. And then we've asked them for some limited EHR data, to look at changes pre-post involvement. So stay tuned. We have got signed contracts and they'll be joining us fully in November, December. So that's been excellent. And I also wanted to talk about the sister program, which is the same kind of, again, all teach, all learn, demonopolizing expertise around dementia-friendly programs. So here in the Seattle area, in the I-5 corridor, we have richness of support groups, educational events. The Momentia community is very active here. Of course, Dementia Friends, which Katie did a fantastic job talking about. We've got some amazing intergenerational programs. The first one I went to when I first came back to the UW about 10 years ago was a dementia-friendly intergenerational storytelling event, which was so cool. It was fantastic. So how do you do that in places like Omak or Ellensburg or Walla Walla, right? Places that have some of these resources, but don't necessarily know how to get something like this up and running. So that idea of using the Echo platform to do that. So to date, we've had about 120 different individuals participate. I don't have a fancy map that shows you where they are, but we've got folks in Bellingham, Spokane, Vancouver, Yakima, a bunch in the Seattle area, but not in Seattle. And these are, librarians, people who work at senior centers, activity directors, fewer of those, but who are working to develop dementia-friendly programs and services. And typically the format is there's either a short didactic about, if you're going to create outdoor activities for people with dementia, here's, some examples, here's how you do that, here are the things you want to think about. And then there are some, kind of triaging struggles of, boy, we're having a hard time getting people to come to this, how can we market better? And people from all over the community provide their kind of expertise on what's worked for them. People rate it incredibly highly, and it continues to click along. And then there is a annual conference that we talk about all these fantastic things too. And I think I will close with the slide that I almost always close with, which is, the I have a good life, which the first time I heard, and this was a long time ago, but the first time I heard the idea of living well with dementia, that was a radical kind of idea. And, the more of these programs we have, the better workforce we have, the more dementia friendliness we have in our communities, the more this is possible. And I think the more this is possible even later into the disease course. But really, I think that's, the foundation of what we do here at Memory and Brain Wellness across all three arms, the EDRC, the clinic, and then the Memory Hub, really is to make sure we are maximizing the likelihood that people can say this for as long as possible. There's my contact info. And that's what I had. We've got some time for conversation. I haven't been keeping an eye on the chat, but I'm happy to stop sharing, see each other.
Thank you for that fantastic presentation, and thanks to you both for the amazing work you're doing to transform the lives of people living with dementia and to change how things are in our state. It's just really wonderful to hear all of the things that you've done and how successful they've been so far. So thank you. There are a few questions in the chat, and it looks like Katie's been answering a bunch of them already,
Oh, good.
which is great. It looks like Dr. Chen was